Since the last talk about vitamins and cancer on Killing Cancer Kindly, I have been inundated with questions and comments. And many people have personally called to ask questions about vitamins. I have selected 5 important questions which are very common and most people have been asking, and I'll do my level best to answer them as quickly as possible. So, question number one, very obvious. Should we take synthetic vitamins or not? And the answer is yes and no. If you are suffering from a deficiency of vitamins, do take the synthetic vitamins because they are going to replenish the deficient state and bring your vitamin levels back to normal. But once you have finished a course of vitamins, please recheck your levels. If they are in the normal range, stop taking the synthetic vitamins and maintain the normal levels by dietary sources such as fruits and vegetables, which are the safest and best way of providing vitamins to your body. The next question I'm asked is, I do not take any artificial vitamins. Should I worry? And the answer to this question, unfortunately, is yes. Most of us are taking artificial synthetic multivitamins unknowingly. They've been fortified in the food for decades. More than 80 countries have national fortification programs. Many of the countries are funded to provide these essential nutrients in the food fortification. Some of these fortifications include folic acid being added to the flour. And the concept behind folic acid fortification is that it reduces the risk of neural tube defects, defects in the spine of babies born to pregnant women. And I stress on the word pregnant women. What totally baffles me is that to reduce the risk of a few hundred babies born with a neural tube or spinal defect, which is very important, we are feeding the whole population. Almost half of them are men, which are never ever going to get pregnant, even if given a chance. And we are totally ignoring the risk factors associated with it. Trials have shown that folic acid supplementations can increase the risk of bowel cancer and increase the risk of prostate cancer. Yet we are feeding people from before birth till death. And I say before birth that pregnant women are being fed fortified flour and fortified food till the time they die with synthetic vitamins which carry the risk of increasing cancer. And this is happening globally. The risk of cancer has been going high as more and more fortified food at national level or private level has been coming to the market. Many of the juices and the cakes and the cookies and other dietary items you take are fortified with multivitamins. The only benefit from this fortification at a mass scale, giving it to the whole population, whether they need it or not, is increased revenue for the companies who make them. So, unfortunately, even if you and me are not taking these synthetic vitamins, we are still being exposed to them. It is important that we identify this fact and we try to stick to the diet which is organic, which is pure, and which has not been fortified. The third question I'm often asked is why nobody else is talking about it? And the answer is not very straightforward. Well, if you look at the vitamin industry, at the turn of the century, the year 2000, just in America, it was making somewhere around $20 billion a year. But at present, it is making around $140 billion a year. Same thing is happening in the rest of the world, especially in the United Kingdom and Europe. And in England, the risk of cancer has increased from 33% in the year 2000 to 50% in the year 2020. Nobody is bothered about the sudden rise of incidence of cancer. The lifetime risk is increasing, and we have become the only species of animals on this planet which have a 50% lifetime risk of having cancer. And I think synthetic vitamins and fortification of food has a role to play in it. But because it's a multi-billion dollar industry which has a very strong lobby, there is little incentive to talk against it. And On the other hand, there is very little funding for more trials to look into the exact impact and the share of multivitamins in causing cancer. And this is something we are going to change. Killing Cancer Kindly talks about these subjects, and we do not have a bias towards any company or any pharmaceutical industry. We respect them for the good work they're doing, but we think there is a big gross oversight when it comes to synthetic vitamins and them being provided over the counter without prescription to everyone and being added to food so people are inadvertently, unknowingly taking them. The fourth most common question I'm asked is, what are the other risks of synthetic vitamins apart from increasing the risk of cancer? And the answer is hypervitaminosis, a condition in which there is increased amount of vitamin in the body. And this is especially important for fat soluble vitamins. There are some kind of vitamins like vitamin A, D, E, and K, which are stored in the fat of the body. And once you have got it into the fatty tissue, it's very difficult to get rid of them unless and until the body slowly uses them over time. Hypervitaminosis can cause a lot of problems depending on which vitamin you have overdosed on. For example, vitamin D hypervitaminosis can cause nausea and vomiting and diarrhea and headaches, can give you depression and cause insomnia. It can also affect your heart, your liver, your kidneys, and other organs in the body. It can increase the levels of calcium, which can cause kidney stones. And the list goes on and on. For more information, please consult Killing Cancer Kindly library of videos on specific vitamins, and we'll be providing more of them in the future. So please be careful. It's not just the increased risk of cancer, but also a risk of toxicity, direct poisoning from having too much vitamins in your body. And we need to avoid that. The best way again is to take natural vitamins in form of fruits and vegetables, because you are most unlikely to overdose on them, and the body only absorbs what it needs and leaves behind what it does not require. Synthetic vitamins, they force their way into your body and get stored in the body, especially the fat soluble ones, and stay for as long as you are not able to get rid of them by using them. Synthetic vitamins force their way into your body and stay there for a long time, especially the fat soluble vitamins which are stored in your body tissue. And there is no antidote to them. Once they are in your system and stored in the body, the only way to get rid of them is to wait and hope that they get utilized over a period of time. Question number 5, which is very commonly asked: how can we warn people about the dangers of synthetic vitamins? And the answer is 3 words: killing cancer kindly. You can share this news with all of your family and friends. Ask them to subscribe and press the bell icon so they can get regular updates on all health matters related to cancer and general health, especially on multivitamins. And we also need to make sure that when we choose our food, it is free of fortified vitamins, because that is an unseen and unknown danger which causes toxicity in the body and increases the risk of cancer. We also need to lobby and to ask our government that we should not have fortified food for everyone. Fortifications like folic acid for pregnant women should be given to pregnant women, not to men who are never ever going to get pregnant. But for that we need numbers, because there is strength in numbers. Killing Cancer Kindly is a mission to prevent, detect, treat and cure cancer. And we are not able to carry out this mission without your help. So I would like to request you to join us on this mission, get abroad, and share this information with as many people as you can. Together, we can save more lives. Thank you very much for your time. Thank you very much for listening. I look forward to seeing you again. Bye.